Chances are you already know somebody who's been hit with the flu. KPIX5's Len Ramirez tells us that doctors are particularly worried that we are in for an especially bad flu season. Len, we're already in it.
We're already in it. I just talked to somebody who came out of the emergency room here at Good Samaritan Hospital who said that the waiting area was filled with people exhibiting all sorts of symptoms of the flu, just looking miserable. The flu is definitely here, and it does seem to be packing a more powerful punch than last year. Staff and volunteers at Good Samaritan are taking extra precautions to avoid getting the flu. After a spike in cases beginning around the holidays, the hospital also began a temporary restriction of visitors under the age of 16.
Kids obviously are more at risk for getting respiratory illness, and then quite frankly they don't always cover their coughs or their sneezes, and germs spread more easily. So it's to protect other patients, staff, and the children. So far, Santa Clara County has seen 4 deaths attributed to the flu in what doctors call a particularly bad season.
It came a little bit earlier than last year's, and it looks like it's more severe than last year's as well.
Assistant Santa Clara County Health Officer Dr. George Hahn says this year's strain, called AH3, is likely to make more people sick.
What we know is that it tends to produce more severe illness and more hospitalizations, and whenever there's an H3 year, it seems that more people get the flu.
Dr. Hahn recommends people get flu shots as soon as possible, although reports from Australia say the vaccine was only about 10% effective in that country. It could do better here.
That is Australia, and in the United States we actually have a much higher rate of vaccination against flu. And so because of that, that helps produce herd immunity. And with herd immunity, that means the vaccine tends to be a little bit more effective.
And the flu shot takes about 2 weeks to become effective against the flu. So, Ken, those warnings that go out at this time of year, definitely in effect right now. Wash your hands a lot, and also cover your sneezes, cover your coughs. Don't spread it around. And if you're sick, definitely stay home.
Len, I picked up some Tamiflu for my granddaughter last week. She's very sick, and I heard it might be in short supply. Is there enough around?
Well, I did some spot checking around here. Kaiser says that they have plenty of Tamiflu. I did some random picks out of CVS pharmacies. They had it. But you do hear about shortages here and there across the country right now because this flu is spreading. And there are some shortages, but apparently other places that have run out, maybe another pharmacy down the road will have it.
Len Ramirez, staying healthy in San Jose. Thanks, Len.